Hi, I'm Dr. Ceres Paulino-Canto and you're watching The Dose, your healthy serving of medical information from the Los Santos Medical Center. Congenital heart disease or CHD occurs in about 1 out of 100 live births. There are many types of CHDs, but among the most common are ventricular septal defect or VSD, atrial septal defect or ASD, and patent ductus arteriosus or PDA. If you want to know more about CHDs, keep watching this video. ASD is a birth defect in which there is a hole between the upper chambers of the heart or the left and right atria. On the other hand, VSD pertains to a hole in the wall separating the two lower chambers of the heart or the left and right ventricles. PDA is a condition wherein a blood vessel that normally closes after birth remains open. This blood vessel connects the two major arteries of the heart, the pulmonary artery and the aorta. In general, all these conditions cause an overflow of blood to the lungs and increased workload of the heart. Over time, this causes symptoms of congestive heart failure where the heart is unable to pump enough blood to meet the demands of the body. Babies and children who have ASD, VSD, and PDA may experience the following symptoms: fast breathing and heart rate, difficulty breathing because of excess fluid in the lungs, poor growth and weight gain because the energy from food is used up by the heart as it works harder to pump blood. With significant congestive heart failure, the heart is pumping so hard that you can see the impulse in the child's chest. Babies take a longer time to feed, sometimes falling asleep before finishing. Increased sweating, especially on the head, even when it's not very warm. This may become even more noticeable during feeding. Decreased energy and increased sleepiness, delays in reaching developmental milestones. Older children may get tired and short of breath easily after walking or playing, and may also develop edema or swelling of the feet and legs. These symptoms might not appear right away, but they can occur weeks, months, or even years after birth, depending on the size of the lesion. Several diagnostic tests may be needed to fully diagnose a child with a congenital heart defect. These include chest X-ray to show if there's an enlargement of the heart and changes within the child's lungs. An electrocardiogram records the electrical activity of the heart and shows abnormal rhythms and thickening of the walls of the heart. An echocardiogram shows the nature, location, and size of the defect and rules out any other additional abnormalities in the heart. Depending on the diagnosis, age, general health, and severity of symptoms, there are several ways to treat congenital heart defects. Medications can be used to improve the symptoms of heart failure and prepare the patient before closure. For patients with VSD and ASD who undergo surgical repair, the heart is opened and the patch is used to close the defect. These patients need to be placed on cardiopulmonary bypass or a heart-lung machine during surgery. For PDA, because the extra vessel is outside the heart, there is no need to open the heart or to place the patient under cardiopulmonary bypass. The vessel is closed using stitches or clips. Cardiac catheterization is a non-surgical method to deploy a device that closes the defect, using a catheter that is inserted into the blood vessel near the child's groin. This method has become the treatment of choice for PDA in children and adults, sparing the patients from surgery. The Los Santos Medical Center has a well-equipped catheterization laboratory and operating room complex to treat ASD, VSD, and PDA. We have a competent team of pediatric cardiologists, pediatric interventional cardiologists, and cardiovascular surgeons who can perform ASD, VSD, and PDA closure on the smallest of infants. Your child's safety is also our priority, so we practice strict health and safety protocols before, during, and after every procedure. Our highly trained nurses and medical staff ensure that your children get the best care possible. And to top it all off, we offer affordable PediaCap packages for ASD, VSD, and PDA closure, so your child gets treatment without financial worries. For assistance, contact our Congenital and Structural Heart Unit, which is fully dedicated to accommodating children with congenital heart diseases. ASD, VSD, and PDA closure is generally safe and has excellent results. Closing these lesions restores normal circulation to the heart, eliminating symptoms of congestive heart failure and other complications. For inquiries, give us a call at the number flashed on your screen. Again, this is Dr. Ceres Paulino-Canto. Thanks for watching The Dose.